Good evening. I'm Dr. Mansi from Homeopathy 360, and we're back again with another beautiful webinar with Dr. Harshini Jain. In the Beyond Boundary with Homeopathy 360 webinar series, we are with Dr. Harshini ma'am on the another topic, that is PCOS. That is healing hormones with homeopathy. So let me introduce Dr. Harshini Jain ma'am, that is homeopathic physician, life coach, counselor, and motivational speaker. Dr. Harshini Jain ma'am is a dedicated and dynamic homeopathic physician from Mumbai with over 13 years of experience in holistic health, mind body healing, and personal transformation. A graduation from Ahmedabad Homeopathic Medical College. She also holds a diploma in diet and nutrition and is a certified life coach and integrative health coach. And not just this, Dr. Harshini ma'am is a renowned medical practitioner in South Mumbai. She has been awarded with Integrative Health Coach Award by various organizations and recognition by National Health Conference held in Maharashtra in 2024. She had been awarded COVID Warrior Award in 2020 lockdown for her remarkable work by using homeopathy. She has been invited as motivational speaker at various events organized by Jain International Organization and etc. So we are the uh, so we are very inspired by Dr. Harshini ma'am, and I think all the students and attendees are very eager to attend this webinar. So ma'am, please begin.
Thank
So
you. Thank you,
ma'am,
Dr. Mansi.
yes ma'am.
Thank you for this introduction, but it is just overwhelming me. It's just our contribution to the society. And thank you for giving me this opportunity where I can address the participants on this.
Thank you so much, ma'am, for coming on this platform. So, ma'am, first of all, my question to you, why did you choose this topic, that is healing hormones with homeopathy, clinical insight, and biohacks for PCOS and beyond?
So, as we all know, Dr. Mansi, PCOS is a growing problem now. I think 1 in 3 women now are having PCOS. And for, I think, all the participants over here, whether they are students or medical practitioners, I think everyone knows that PCOS is just not limiting on irregular periods or inability to conceive a child, but it is a very broad spectrum where a woman's health and body is affecting on various planes, not just physical but also mental, emotional, and it has a lot of effects. So I think PCOS is a problem where we genuinely need to address a lot of other modifications along with homeopathic treatment, where we have found that biohacks and healing hormones naturally, their diet, their regimen, and the lifestyle changes are making a remarkable difference in their health once we do that.
Okay, all right, ma'am, that's true. So, ma'am, first of all, let make the attendees and our all the general public also aware about the PCOS. First, let's understand what is PCOS and how can we explain to a layman person about
Okay, so see, as far as we already know that PCOS is a hormonal disorder,
it. Yes.
basically in which there is excessive cyst production in the ovaries on the outer margins of the ovary, and the entire this thing of imbalance has happened because of the imbalance of hormones, right? So when we are beginning how it happens, and when we are explaining this to layman, we have to use a layman language so they can also understand. So hormones are basically the messengers in human body which carry the message from one organ and one tissue to the
Mm-hmm.
another. So now what happens is that insulin is a very important hormone. Insulin, as we all know, is produced by pancreas, and whenever there is a excessive sugar in the body or salt, excessive stress, the insulin starts pumping more from pancreas to combat with that. Now, what happens? This excessive pumping of insulin can lead to high androgen level, high androgen production in the body. What are androgens for layman? They are the male sex hormones. Now, this excessive androgens in the body can lead to imbalance in the female sexual hormones, that is estrogen and progesterone, and which actually leads to this problem of PCOS. Now, this imbalance causes a lot of other stuff, like, when there is a lot of acne on your face, there is excessive hair production on your face, on your chin, and male like hair growth that is especially showing you hirsutism. And these are the basic things which happens on the early stages, and then we get a full-fledged PCOS symptom where your periods become irregular, or there is absence of periods, there is weight gain and obesity. So for a layman, you have to explain them that this is a hormonal disorder which is happening because of imbalance in hormones, and we have to treat the root cause for this.
Okay, okay. Thank you so much, ma'am. And ma'am, if one asks, what is the cause behind it? How can we answer this question?
See, there are various causes of PCOS. It is not something like that it can be only genetic, or, there is a lot of myth where people feel that PCOS is generally happening only to those young teen girls who are obese, who are very, who have pear-shaped body, who have more deposition around their bust and buttocks. It is not like that. I have seen PCOS which is happening to lean people also. There is inflammatory PCOS. There is PCOS because of leaky gut. There is PCOS because of constant short infections and inflammation happening to the body. So I will explain that. But the major reasons of PCOS, if we are enumerating it, it can be hereditary. It can be basically because of hormonal imbalance, which is happening because of your diet and lifestyle. Now, your lifestyle plays a major role in inviting lifestyle disorder, be it PCOS or thyroid or anything. So, your diet and lifestyle plays a major role. Also, your gut permeability is very important, because a lot of people here must have heard the name leaky gut, and this leaky gut is responsible for a lot of lifestyle disorders like PCOS and thyroid. So I think if you're enumerating hormonal imbalances, long-term infections and inflammations, also you are getting headache, you are popping a pill, you're getting fever, you are popping a pill, you are getting migraine, you are popping a pill. For
Mm,
everything you are popping a pill, and these pills are
mm,
painkillers, NSAIDs, or general whatever crocin dolos you are taking. All this is going to affect your hormones and your immunity. So this in long term can lead to imbalance in your hormones. Also, one of the major factor which I have noticed nowadays is mental stress also affects a lot. Earlier we were finding, like before 5 years, PCOS only commonly found in young girls, where we find that because of the diet and lifestyle they are developing PCOS, that is sedentary lifestyle and junk diet. This combination of having junk food along with cola, that is the aerated drink, which is the major reason. But nowadays we are finding stress induced PCOS also a lot in middle aged women, where women between 35 to 40s are developing PCOS a lot, and that is because of excessive mental stress and strain.
mm. And ma'am, from your experience, how common are hormonal imbalance today, and why do you think the numbers are rising?
See, the numbers are rising a lot now because of our lifestyle. As I said, we are just sitting at a place, eating food, scrolling social media, and this has become a routine. I think people have just forgotten that human body is made for movement, and once this human body does not get this movement, it is going to show the sign and symptoms. So when it comes to young generation, it is showing in the form of PCOS, where there is irregular periods, there is acne on their skin, and unhealthy diet, which is playing a major role. Everything which is very easy and very quick to cook, all of that things, 2-minute noodles, or be it your soya chap, and be it your even dairy has become a big culprit now, because the milk what we are having is injected by hormones, and this is majorly disrupting the hormones in young girls, because it is not the same milk which maybe our parents and grandparents consumed before years. So I think dairy is playing a major role, stress is playing a major role. Nobody is addressing anxiety and emotions for any age, I feel. Also, one of the most important factor is sleep cycle, because I think none of the people are giving. India is a country where sleep is usually deprived. I think people really boost that, I worked till late, or I studied till late, and at certain age we don't realize that how your sleep cycle is actually affecting your hormones. See, when we are talking about sleep, the time between 2 to 4 a.m. is the time when your body is naturally regenerating and repairing. So if a person is not sleeping on time, then that regeneration and repair is not going to happen, because your gut is not properly working. You are stalking on social media, you're watching Netflix, and then you are sleeping late. So when you are watching all of this, you're hogging some unhealthy or healthy food. So now your stomach and your gut is still digesting the food which you are having till late. So how the gut is going to get time to heal your hormones now? So it's completely our unhealthy diet and lifestyle which is playing a role. And this is when we are talking about young girls or young women getting PCOS problem. When we're talking about middle-aged women nowadays getting PCOS problem, also middle-aged women nowadays getting early perimenopause. We are not talking about menopause today, but when we're talking about hormones, I would like to say that people are getting menopause very early now. That is the perimenopausal phase, which was earlier in 40s, has now come to 35. And this happens because women have a lot of role to play. And in this pressure cooker situation, we are just running and forgetting that what your body actually needs. So there are lots of myths which we need to correct. Also, there is a trend going on fat diets, which they call sustainable, but these fat diets are actually harming your hormones and your health more. People take 45-day challenge to reduce weight. And, I don't know how this is going to affect your hormones when you are trying to lose weight so quickly, but not focusing on sustainable weight where your hormones are also not getting affected. So this has become very common now because of this fed trends, the diet and the lifestyle we are living in.
Okay, ma'am. And ma'am, can you walk us through a typical case of PCOS you have treated that stands out in your healing journey, or we can show to our audience?
Yeah, see, I would like to share one case which is always stood out for me, and I think every homeopath would relate this to me for this, because not many cases we get where we can actually prove that how homeopathy is better than other school of medicines. And actually, to prove this to people that homeopathy, there is the power in medicine where we can reverse lifestyle disorders also. So this case of mine was of a young girl who is actually pursuing MBBS in Russia currently. And she came for her summer holidays to India, and she came to me last year, I think around this time, or earlier than this. And a classical case of Naxwamika, I think, a classical case, very focused. a very focused student, why she wanted to be a doctor. She was so focused about her marks, how she performed in NEET, and how she didn't secure anywhere, but she still chose Russia. She went there to pursue MBBS. Now just look at the life for every medico we see, whether they're MBBS student or us. We struggle a lot to achieve our dream. So this girl has gone to MBBS to pursue her degree, and we all know the hardships we face if we are living somewhere far from our house, and we are living in hostel, especially in this case when you are changing the country. So your lifestyle has changed completely, your diet has changed, and it's not actually what your body is made up of, and a lot of stress. So unhealthy diet, and not organized sleep patterns and stress, and these were the reasons, these were the factors because of which first of all her periods started becoming irregular. She started getting a lot of signs and symptoms which classically she was representing, and but very much focused. So she will not sleep, she'll wake up till late, and she'll finish her studies just like Naxwamika, very passionate, and like that workaholic, and everything what we noticed in Naxwamika was present. Also, one of the important factor to highlight here was that studying, when you're studying, we cannot afford falling ill, and this is where she started falling into taking these pills easily for treating her migraines or vertigos or fever, and this long term intake of these pills led to a complete gut impairment in her body. And mentals also, when I saw, they were very much like Naxwamika, and as you know, classically we introduce the same medicine in the right potency and with the right dosage and repetition, we immediately start getting signals, and that how uh, gradually the body starts throwing out the symptoms in the reverse order. But this patient of mine was very knowledgeable. Being an MBBS student, she she took a she took a lot of effort, I think, to understand homeopathy way. And I think the result what she got, I think that spoke everything. I think this is the best thing what our patients can get when we choose about healing with homeopathy. It is the result which talks, and that period which was missing since 3 months, when it comes back. And that happiness, that when she's messaging me that now I have got, and I think I am defining this, that how this case stood out for me, and now she's completely fine. There I needed to give her Hamamelis also, because at times I thought that she was bleeding a lot, and she was not in India also that time. But with proper dosage and repetition, and I think she's fine now. And this is a case which I will always remember, because there are very few people, whether they are laymen or from other school of medicines, who understand and who try to perceive homeopathy in such a deeper way. So this case will, I will always remember this case. But the power of homeopathic medicines, I'm just telling you, we can treat everything. I feel any lifestyle disorder we can reverse, but there has to be two three pillars for this. First of all, that the right medicine has to be administered. You have to perceive the case in a right way. Secondly, the patient cooperation is also very important in case of lifestyle disorders. And third is diet and lifestyle modification. This has played a huge role in her recovery, especially when I see other cases also, whether they are of PCOS or thyroid, Hashimoto's. I feel diet and lifestyle modification plays a major role in recovery.
Thank you so much, ma'am. That is a wonderful success story of homeopathy. So, ma'am, there's always a doubt. Many patients were overwhelmed with homeopathic treatment options. How do you guide someone to trust the homeopathic process?
See, Dr. Mansi, see, as far as I know, this line I have heard in my college when my professors used to teach us, and I have observed this also many a times, and in today also clinical practice. Now the time has changed. Earlier, also in the initial days of my practice, I have noticed cases of PCOS or thyroid, which always used to come after going to the other school of medicine. So they have always gone to them. They have found that there are no results. There are only hormonal pills which are going to be given, and there are cycles of hormonal pills, and still their periods are not coming normally. Still, the in case of PCOS, especially where the other school of medicine only focusing on restoring the period cycle, forgetting there are a lot of other symptom of PCOS which needs to be addressed, like individual symptoms, mental symptom, individualizing emotional symptom, which only a homeopath can understand, what only the patient is talking to us, which I doubt the other school of medicine can ever understand that. Second, and the most important is, when we are talking about restoring the period cycle for a PCOS patient, it's not only restoring the period cycle, it is about restoring their complete hormonal cycle. So your insulin is getting restored over here, your estrogen progesterone is going restored over here, your gut, which is completely impaired, because as we all know that gut is our second brain, and till you are getting your gut reset, you are not going to cure your lifestyle disorder. I think these basic things, I think the patients also now understand that we are not going to get this. Many people I know nowadays are coming directly to a homeopath, that we don't want to take this hormonal pills. There are mothers who are coming to us that my child has missed her period. Yes, she's having irregular cycle, or she has been diagnosed with PCOS. We have done the sonography, but we don't want to go for the hormonal treatment. We don't want side effects on her body, and that's why we want a homeopathic treatment for this. This is the time now. But earlier, when I think initial days of my practice, I always used to get these cases where I used to feel the importance to preach to the patient that choose homeopathy. Why homeopathy is better, no side effects. Only restoring the period is not the goal. You have to restore your body completely. We have to and make the patient understand all of this thing. But now the time has really changed. There are people who are so much educated and well informed because of social media. I think internet has hugely played a role. Secondly, that people are also seeing that only taking hormonal pills is not restoring their cycle. You take 2 months cycle, you make 3 months cycle, the period will come fourth month. When you stop the hormonal cycle, the period is not coming back. So this is where their limitation is, and this is where homeopathy has shown its remarkable effect. I think now the time has really changed, but still for a lot of people where they don't have awareness, we can always make them aware that in case of PCOS, only restoring the period cycle is not what homeopathy does. And what all, there are symptoms that, in case I have seen a case of lean PCOS where the patient is not getting the regular menstrual cycle, but whenever the day when the ovum is supposed to get discharged, or the day when the patient is missing that period and that hormones are going up and down, she's feeling tremendous gastric trouble, she's feeling so much bloated, and there are so many other symptoms which needs to get addressed, because you have missed your period, or maybe your period is delayed, maybe there is very scanty period, maybe there is only spotting. So all these things the other school of medicine is not restoring. So I think this is the thing which we can educate the patients to choose homeopathy for, which as far as I know, now we don't need to. There are a lot of informed patients, but still, as you asked.
That's really happy to hear that. And ma'am, what are some of the biggest clinical challenges you have faced when treating hormonal imbalance and PCOS?
I think the biggest challenge is to make your patient understand that you'll require patience for this. And because many times the right medicine also, and right given potency also, and there are a lot of suppressed chronic things which try to come out. So the aggravation, if we talk about, or old symptoms reappearing, or many a times I have noticed that patients behave very impatient, and they feel that within 1 month or within few days only we can see changes in case of hormonal disorders. But I think insulin resistance is the main problem here, and till the time we introduce the right medicine, the right diet and lifestyle modification has been done, and then the patient start getting the recovery sign and symptom. So to hold on to them till that is very important. Many times it used to happen in my initial days of practice also, that patients start thinking that there's no recovery and nothing is going to happen, and maybe they start hopping here and there. So I think every homeopath over here will also relate this too, that there have been cases where it happens. But I think slowly and gradually you understand this in your clinical practice, that to explain this to the patient, that this will require patience, as there are a lot of suppressed symptoms which are going to come out, and there are lots of suppressed diseases which they have been suppressed earlier, instead of taking homeopathy and choosing other topical ointments or anything else. Also in case of skin disorders also, this is very common for me. As far as a case of psoriasis, I have noticed that this has happened, that many a times patients start becoming impatient, that there is no result. But the patience is the only key here.
Ma'am, are there any common mistakes practitioners or even patients make during the treatment?
Common mistakes, I would say that in case of a practitioner, we can always say that the dosage or the repetition or the complementary medicine, these are the factors where we usually go wrong in the early days of the clinical practice. But I think every homeopath should along this has helped me a lot, and I would always preach any students over here also, that see, theoretical perception of homeopathy is very important, because this is what you learn, this is what you have to learn about the drugs and our medicines. But the clinical approach is very important. I used to go to my mentor, my sir, right from the third year of my college, and to learn how he perceives case and what he does in case of follow-ups, repetition, complementary medicine, dosage, potency, and lot of stuff. And the struggle remained even in the initial cases, initial time of my clinical practice. But I think this is a very important part, when as a doctor, you know that you have given the right medicine and the right dosage, and now the patient has come for follow up. Maybe as I said, the bleeding increased, I gave mmls, or maybe some other symptoms came up. This is the key, how you handle the cases. This is very important. One wrong move here, and again our growth gets stunted. So here clinical experience plays a major role. So I think clinical knowledge and clinical experience is very important for this. And always you can have your mentors who can always guide you through your clinical practice. We have a lot of interns coming at our clinic for this purpose only. So this is very important. And also the second thing, mistake from the patient side when we are talking is, in case your patient becomes panic that I'm bleeding a lot now, and the bleeding has not stopped till 8 to 10 days, what should I do? So here it is very important, because what if they start losing hope on you? What if they think that this is something wrong going on in my body and I'm bleeding? What if I'm happening some irregular or unextended amount of blood loss? So this is very important, as a clinical practitioner, to judge where you have to administer which medicine. And even after giving the right medicine, what if your patient is panicked, and he or she requires a proper interpretation? This is what clinical experience plays a major role. And I think this is what I have learned in a decade, that how much ever I learned in my college, I scored or I topped in my exams, but the clinical experience and those flashbacks have always been on my mind, that here maybe I went wrong. I've lost a lot of my clients like that in my cases, when I used to feel that maybe this was that, maybe I became desperate. This is how you learn, and this is every homeopath's beautiful journey, how they learn. It's not necessary that immediately you'll start getting the right medicine, immediately you'll get the right dosage. But yeah, you have to perceive the case thoroughly. And when I say perceive, this is the word my mentor used to use, because when we perceive it thoroughly now, then it will happen. And clinical experience, I always say, is extremely important along with your studies. I urge every homeopath to have clinical experience before going out there and practicing as a homeopath.
Ma'am, you often speak about the biohacks. Could you please share a few powerful ones that complements homeopathic treatment for PCOS?
Yeah, so this biohacks and this superfood, these all terms have become nowadays very common because of social media. I think on my social media account also, there are a lot of DMs. We get that, please tell us superfoods for PCOD, please tell us biohacks for thyroid, PCOS. So actually, what are these biohacks and superfood? These are the same things which we all know already, but now these terms are trending so much because of social media hype, like on Facebook, on Instagram, on YouTube. Yeah, when we say superfoods, tell us three superfoods for hormones, and people start enumerating them. Let's start doing seed cycling, or start your day with 1 teaspoon of ghee. And lots of these things are there available on internet today. So I would say there is a comprehensive treatment needed in case of reversing any lifestyle disorder, be it PCOS and thyroid. But as you have asked me today, some biohacks, I think the major three biohacks for PCOS are your sleep cycle. This is the biggest biohack we have to do, because the regeneration and repair which is going to happen in your sleep is not going to happen anywhere else. Secondly, when we talk about restoring the sleep, there are people who are coming up and telling that we are not sleeping, we are just not getting sleep. It's been 1 a.m., it's been 2 a.m., and then we'll fall in a dreamy sleep, and then we are not able to wake up early. Remember that the preparation for a good deep sleep starts almost 12 hours before. Now, how much your skin is getting exposed to sunlight is extremely important, and nobody talks about all these things on theoretical basis when you are studying in a college. This is all the clinical experience which we have, everyone has got through practicing in your clinical practice, and being in up to date being on a up to date data with the health going on in the world around. So when we're talking about sleep, how much melatonin you are getting exposed to sunlight. See, only taking pistachios or taking melatonin supplements are not going to help out you in this. So sun exposure, this is the biggest biohack. The more you'll expose your skin to sun, the deeper you'll feel asleep at night. Secondly, as I always say, human body is not made for sedentary lifestyle. You can't be a couch potato scrolling social media, or maybe even scrolling your materia medica textbook. You have to indulge in any kind of exercise or physical activity, be it yoga, be it gym, or be it a running, a walk, or playing a favorite sport. I think nobody told me all of this thing even when I was studying in a college as a student. Nobody tells all this thing. But now the trend has really changed, and it makes a huge importance when you tell all this to your patients. Your patient feels more connected. Your patient understands that you are just not focusing on giving homeopathic medicine, but you are trying to heal their body and their hormones from within. When you're talking about this now, I always preach my interns or preach everyone I know around, that what about healthy versus medicinal? I always say, be it a homeopath or a Ayurvedic doctor or any school of medicine, I think now is the time when we should stop practicing medicine just to give and administering our medicine, but we should start looking health in a very broader spectrum where we perceive food as medicine, because our food has the capacity to heal our body on its own. There are lots of places where you will find lots of blogs, lots of videos, lots of books being written on this. So it's high time that you don't give emphasis to this and your patient is gone like this. So all of these things are very important in your clinical practice. So the first biohack is, I would say, sleep. The second biohack is your physical activity, which is like not negotiable at all. The third is your diet. The superfoods which I would say for PCOS are: start your day with a good fat. When I say good fat, it can be pure desi ghee, it can be coconut virgin oil. You have to start your day with a good fat because it is the best thing which is going to heal your hormonal cycle and your balance. And this nobody is talking about. If you're only going to practice homeopathy also like that now, your patient is not going to sustain for a longer period of time, because they will think you are just treating this for giving homeopathic medicines. So when we are talking now how to handle the patient that way, these all things will help us in our clinical practice. Third thing, what I would like to say, the good biohack is plant-based food is also very good and sustainable for treating hormonal condition. So these are the few biohacks I can say in short. And in comprehensive way, if I'll start saying, then it will, I think, take the whole night, because there are lots of superfoods and biohacks we can say, as we said about seed cycling, that sunflower seed, pumpkin seed, flax seeds, and sesame, how you have to do seed cycling for 15 days in luteal phase and follicular phase. All these are the biohacks for restoring your hormones if you have PCOS.
Okay, that's really great, ma'am. So, ma'am, our next question was the same, that what role do diet, stress management, and sleep play in hormone balance alongside remedies? I think you have already answered.
Yeah.
But ma'am, can we now focus on the stress management? Does it play role in the PCOS treatment?
It plays a huge role. And we also know that one of the major reasons for getting this hormonal disorders like PCOS is also mental stress and emotional imbalance. And that's why and we always perceive human body not only in physical form but as emotional and mental symptoms. We 3 mark to apne usi ko dete hain, plus 3 is for
Uh-huh.
mental symptoms. So that
Yes.
is obviously that is the individualizing symptom when we get that fear and that anxiety of aconite, and you know that passionate nakswamika who wants to overstretch and strain their night but want to achieve their dream, and that pulsatilla which is crying and tearful and sobbing. So we know that that is utmost important to restore today. And as I said, a lot of cases of middle-aged women PCOS, the major reason of this hormonal imbalances are the stress and strain on them. Lot of pressure cooker situation for every woman in India, where they have to, where they are running in this race of proving themselves. Because now we don't have the women who are proving that housemaker is equally important. No, we do not belong to that era anymore. Now is the era when the woman who is CA passed, who is a doctor, maybe a homeopath or an MBBS or an engineering student or an MBA, who is juggling to make her family life and her work life continue for a long time. And in this pressure cooker situation, her hormones are going on a whack because of a lot of expectations from them for the society. So the emotional part needs to be restored by a homeopath, which is extremely important. You are not addressing this emotional symptom. I think, you are missing a important part of the puzzle. Until as a home, because it's a puzzle when the patient enters the cabin, it's a puzzle. As soon as the patient, and I think every homeopath will relate this, if a little bit obese patient is entering, we will immediately think, kya ye calcarea carb hai? Or if a lean is
Uh-huh.
entering, we start thinking, what is it? Or if a person craves for sugar a lot, oh, it must be sulfur or what. So we all have prejudice is always there. It's never gonna go, right? But thoroughly, when we are talking about addressing the patient's emotional symptoms, then if you're not going in depth of dreams, if you're not going in depth of fears, if you're not going in depth to restore that emotional trauma, I don't think you're going to find the right minimum. Not only finding the right minimum, second, in case of lifestyle disorders and treating PCOS, thyroid, Hashimoto's, it is a very important part of your case taking. That important part of the puzzle you'll miss on. So mental emotional symptoms, you can't forget to give emphasis to them. And also, most important thing which I have found, which is only per se to clinical practice, I think every homeopath will relate this to, it calms your patient a lot. It calms your
Hmm.
patient a lot. If you are not addressing them, you are only giving, because you know that these things will be there, and if they are going to get aligned once you give them the right medicine. But even if you're not talking about that and the patient wants to talk, you're not giving that space, the patient will not feel ameliorated. Many times there are patients which I have seen as a student when I used to sit beside my mentor, that patient is feeling better just by talking, that like as this patient who is so talkative, she's better in her menopausal phase just by talking about that. Many times like
Hmm.
किसी से देना भी नहीं पड़ता था. So that crisp you have to get in your clinical practice.
Yes, true. All right, ma'am. Next. Ma'am, many patients sometimes lose their confidence due to symptoms of PCOS, like ma'am, we see unwanted hair, their obesity, and whatnot. Ma'am, how can we manage this problem? Do they require any counseling, or do they require any other medicines for this lack of confidence, or how can we deal this?
For obesity and weight gain in cases of PCOS, and the
Yes,
patient is feeling lack of confidence because of this.
yes.
Okay, so obesity, weight gain की वजह से lack of confidence है. Also, hirsutism is there. So there are thick
Hmm.
hairs growing on your chin, and
Yes.
all of these symptoms of hirsutism, obesity, which the patient is not feeling good upon. I think emotional, psychological counseling plays a very important role in this. Secondly, you have to explain your patient that this is the outcome and this is not the
Hmm.
causative factor. The first and the initial sign which comes to a person in case of insulin resistance is dark line around the neck. It is about
Huh.
skin tags, that those warts
Huh.
and those skin tags which you get around your axilla. So these are the initial symptoms which you ignored first of all. Second came weight gain. Slowly and gradually your body started depositing excessive weight which you again ignored. Then third came the hirsutism, जहाँ पे androgen level already they went up,
Huh.
and now you are getting this abnormal thick hair. So all this is a part of healing journey. You just have to explain the patient that how this is all going to restore normally. Also now, nowadays only counseling is not getting suffice. There are the patients are also searching a lot of things on internet. This I'm talking very frank because of my day to day practice. This is what I find in every girl who is entering my clinic with PCOS. There are lots of ready-made products available, PCOS juice or PCOS drink to heal that unnatural thick hair growing on your chin. There are patients who will come up directly to you in between the treatment, or they'll WhatsApp you and they'll message you and they'll ask you that can we have this PCOS drink available in the market, online, offline.
Yeah.
There are lots of product available in the market now, where there are combination of herbs and juices which sometimes are good and sometimes are bad. So you have to give your true opinion over here. Many times now, as we all know that as a homeopath, our responsibility is not only finishing till restoring and giving them the right medicine, but diet and lifestyle is also playing an important role. So when you know that your client is obese and is having PCOS, you have to restore their diet journey also. You have to know what which seed you have to give him, which herbs you need to give him, what is the first thing they are going to have. If there is insulin resistance, then fenugreek seeds and fennel seeds are like a compulsion. Now all of this nobody tells when you are studying in college. All this comes with clinical
Mhm.
practice, and it's a beautiful journey how you
Yes, ma'am.
slowly and gradually learn on your own in the clinic. And I think this is what I would preach every homeopathic practitioner or a student who are there. I don't know, or even if there are any practitioner, they must be relating themselves with me, that how this is equally important in case of reversing lifestyle disorders, because many times only right medicine given but your patient will be obese, you're not treating the hormones getting aligned
Hmm.
again. So it won't be a complete cure.
Okay. Okay, ma'am. Next, moving forward, many young patients have this question that PCOS can affect their fertility in the future. So, ma'am, is it true?
Yeah, it is true. It is 100% true. PCOS is affecting the fertility because obviously your ovulation is only not normal. Your
Hmm.
either your ovum is not getting discharged or it is getting discharged. Sometimes you are in irregular menses, you are in amenorrhea, or you are sometimes bleeding heavily or not. So obviously your fertility is getting affected over here. This weight gain is going to affect you, and this excessive hormone deposition which is happening on your pear-shaped body is going to affect you. This high androgen levels are affecting you. So your fertility is 100% going to affect you, and this is the major concern I'm telling you for every woman who is stepping inside the clinic for PCOS,
Uh-huh.
because the other school of medicine is only giving hormonal cycle. So once you take this
Yes.
cycle, your problem is solved. You are getting your periods, but what about the fertility? So
Hmm.
you have to restore your normal period cycle, and this is when homeopathy comes into picture. This is when the diet and the biohacks came into the picture. So the fertility,
Yes.
yes, is getting affected, and it is our moral duty where we need to restore every part of this puzzle when it comes to diet, when it comes to hormones, uh, you know. Uh, Gut inflammation and infection, because long-term NSAIDs, long-term painkillers, especially in inflammatory PCOS, the patient is lean, the patient is not even obese, and but still they have PCOS. Why? Inflammatory PCOS underlying cause, metabolic reasons of PCOS, long-term GERD, and all of this is going to play a role in case of fertility. So you have to treat the gut. Your gut lining is permeable. Once the toxins have started going outside the gut lining, your gut is completely impaired and whacked. And you need a complete gut reset, a complete gut reboot you need to give to your patient. There are a lot of people. There are a lot of people around me, a lot of homeopaths also. They are doing 21-day gut reset and 3 monthly gut reset. This is how your liver will again restore and start removing the toxin from your body, because which is very important. Otherwise, your fertility is 100% going to get affected. And then the patient, if you're not treating it till the length, it's not going to make the difference. So we have to align the hormones also, not only restoring the period cycle, but again the hormones also needs to get aligned. So diet and lifestyle modification will also play a major role. And yes, as you asked, fertility is going to get affected in PCOS.
Okay, ma'am. So it is true. And that means it is important to heal from within completely the whole, person as we learn in the organon. Because it is true that many patients are, rely on the pills. They are just giving their menses on time. That's it. They are only just hormonal pills. So that's not the permanent cure. We have to treat the patient whole and completely. So, ma'am, in the end, if you could give one piece of advice to women struggling with PCOS right now, what would it be?
One piece of advice I would like to give is, I think, check your vitamins and minerals, because vitamins and minerals play a major role. Many time we are not noticing, but in majority of PCOS patient, we always find vitamin D deficiency. We find B12 deficiency. We find magnesium and zinc low. This eventually also we find low in cases of infertile patient. वहाँ पे magnesium and zinc is always less, which is affecting your fertility also. So which are very crucial actually in all these cases. So I would say to check your hormones and your vitamins and minerals. It is very important. Second, I would say check on your diet and lifestyle. What are you having in a day? How much are you sleeping? How much junk are you consuming? What is your sleep life balance? And how much emotional health you are giving importance to, that anxiety or that emotional imbalance, how much you are addressing or you are just suppressing them, because this is somewhere going to affect you. If not PCOS, it will come ahead to unknown causes of infertility. So if not IBS, then it might come in the form of thyroid. So any lifestyle disorder, not only PCOS, I think every woman here should check for her diet and lifestyle.
Okay. Thank you so much, ma'am. So I think it's time to start question and answer section. So Poonam is asking role of nosodes and sarcodes in managing PCOS. How it should be prescribed?
See, as we know, nosodes and sarcodes are also infallible. I think they have always shown us very good results in cases of PCOS. And as far as PCOS is concerned, especially, I have found that when we are talking about this theoretical way in clinical practice, when you find the right medicine, whether it is from nosodes, sarcodes, minerals, or plant kingdom, the right medicine administration is very important, rather than from what and where you are selecting. I have found a case of sepia also, uh, you know a typical case of sepia, where it has shown me a remarkable difference in the line of treatment. So I think the right medicine administered in right potency and dosage is going to get you through.
Okay, all right. Next, we have Dr. Ashish is asking, is PCOS is hereditary? Young girls of 14 or 15 years are suffering from PCOS. Can we dissolve those cysts through homeopathy?
Yeah, many times this is there where yeah, we feel that PCOS can be genetic, and it does, because no study, no trials, and research can prove that it cannot happen. And it is not genetic. Nobody can prove this. It can happen genetic. I have found cases. One of the most striking case was that PCOS was not even genetic, but the mother didn't wanted the child, and that's why she took the hormonal pills. But the child didn't get aborted, and those hormonal pills were affecting the child in the gestational period. And then the child, once she turned 14, 15 years of age, she developed PCOS, because there was no
Oh,
other reason for PCOS, which I found she was such an healthy person. So when you're talking about
yes, yes,
this, so
ma'am.
obviously genes play an important role, but know that n- your genetics are not do not hold that much power in healing you than the power which you hold of your daily lifestyle, because I think your daily life holds a lot of power in controlling your diseases. So if someone whose genes are having PCOS, and the young girl of 14, 16 years of age have started developing, what if she works on her lifestyle modification at a very early phase? Then, and along with homeopathic medicine, this can be treated.
Okay, ma'am. So next is Shiv Kumari is asking, ma'am, how to proceed in a sterility case with PCOD and thyroid.
How to proceed
In a sterility case
in a sterility case
with PCOD and thyroid.
with PCOD and thyroid. So, see, when we talk about if the patient has PCOD and thyroid both, two of the major lifestyle disorder affecting I think, the human race today, and the third is infertility, that is sterility. So, see, I would say that first and the foremost thing is restoring the hormones over here. So here there is TSH, T3, T4 in the play because of thyroid. There is insulin in the play because of thyroid and PCOS. There is estrogen and progesterone, high level of androgens. So here the role of diet and lifestyle modification will be major, along by side with our homeopathic medicines. So all of these two together, we can go towards the process of healing. Yes, it will take time. Yes, there will be setbacks when the patient will lose confidence also, because it's a tough nut to crack, but we can do that. And it has happened. There are lots of homeopaths across the world who are treating this. and it can happen. And obviously it will be very much variable, the age of the patient, the constitution, also any underlying disorders, the genetics we have to know, because they are also under the play. Plus also very important, when a person already has thyroid and PCOS, they will be in there very soon in that pre-diabetic phase, because insulin has already gone on whack. So you have to take care of that pre-diabetics also. And here the diet and lifestyle modification will play a major role, and along with the right administration of homeopathic medicine, you can surely do that. There are a lot of medicines where we have done that. Pulsatilize there, where their patients have been amenorrhea. We have done in Calcarea. Carb is one of the great medicines we have. Patient is obese, patient is having thyroid also, and individualizing symptoms along with that, we can surely treat that.
Next, Vikas Singhal is asking that emotional and psychological changes cannot be seen, but patients wish to see the result in USD. How do you convince your patients to keep patience?
Sorry, can you repeat the question?
So one question is that emotional and psychological changes cannot be seen, but patient wish to see result in USG. So how can we convince
Okay,
your
got it.
patients to keep patience?
या सी यूएसजी में रिजल्ट सबको देखना ही चाहिए होता है,
हाँ.
एंड दिस इज द फैक्ट ऑफ अवर लाइफ. दिस एवरी डॉक्टर स्ट्रगल्स इन. इफ यू हैव अ फाइब्रॉइड का केस ऑल्सो, दे विल गो फॉर 3 monthly sonography and they'll check how many centimeters it has reduced or not. And in cases of PCOS, are my ovaries more bulky than before or not? So this is going to be there. And when I'm talking about emotional and mood swings and all, so, yeah, I understand this parameter, but resilience is extremely important. You need to have a growth mindset over here and explain your patient over here that it is going to gradually happen. And it does show. We have seen cases of PCOS where the bulky ovaries are now getting normal, the cysts are getting reduced. In cases, we have seen remarkable reduction in fibroids. But yeah, patience is the key, and
Yeah.
restoration of faith is the thing which we can give. Also, nowadays, divert your patient a lot into diet and lifestyle modification. Once they come out of this toxic thinking of constantly going for blood markers and USG, and instead focusing on their overall spectrum of health by
Yeah.
changing their daily lifestyle, their diets,
Yes,
and
that's
it is
important.
going to divert them a lot.
Yes, it is a good points to remember. So next, we have what lifestyle changes you must to avoid in PCOS at a very nascent or early age.
To avoid PCOS, what diet or lifestyle modification we should do at early age?
No, he's asking what lifestyle we should avoid.
Okay, so one lifestyle for sure you have to avoid, chances of PCOS, will be to be a couch potato. Stop scrolling on
Hmm.
social media mindlessly. Uh, Anyone, I would say, whether it's a male or a female, not only pertaining to PCOS, because you are just inviting a lifestyle disorder. If it's a female,
Yes.
obviously it is going to affect her hormones, so it will come out in the form of PCOS or thyroid. If it's a male, it is going to come out in the form of depression, obesity, or maybe thyroid also. So no, there's nothing like, let's not be gender biased, but I think one lifestyle which we should avoid is sedentary lifestyle. Secondly, the amount of inflammatory food we are infusing in our gut is really harming our gut flora and fauna. All those food bloggers who are making those reels of food which is available in a particular area and they are going viral, and now we are making plans just to go there and eat those. I think this is completely disrupting our gut. So no mindlessly consumption of food. This 2 minute noodles what you are consuming, or that soya chap on the road, or maybe that inflammatory food which you are giving to your body thrice a week, is making your gut go on a whack. And these are playing with your hormones in long run, and not even in long run, now short run. So
Hmm.
I think this unhealthy lifestyle one must need to avoid. What we can do, if I would rather add, what we have to avoid, I told you. One thing what you can add, which is not related to any method of treatment, be it homeopathy or Ayurvedic or allopathy, I would say start doing yoga at a very young age. To everyone over here, whether you are a homeopath, you are an Ayurvedic doctor, you are a medical practitioner, yoga se hi hoga. I think yoga plays a major
Yes,
role
exactly.
in aligning your thoughts, your mind, your focus, your concentration, your growth mindset, your productivity. It plays a major role. Secondly, yoga has shown remarkable effect in treating thyroid, PCOS. You do bhujangasana and you see the patients of thyroid feeling better. And you do dhanurasana and you see PCOS patient. So when we were also talking the last question, how to tell them to keep patients before doing sonography, divert them for yoga, show them
Hmm.
what all possibilities are there rather than just telling them to keep patience. I think each one of us should go for a yogic way of lifestyle, which is the base of our country today, which we all have
Oh,
forgotten.
yes, ma'am, that's true. Thank you so much, ma'am, for these wonderful advices. And I think we have covered a lot of questions, and I think many attendees have cleared their doubt and gained some insights, such wonderful and important insights from the for the PCOS from Dr. Harshini ma'am. So, ma'am, I would like to thank you for
I
giving
thank
us your
you, Dr.
valuable
Manasi.
time.
No, I
Thank you,
thank
ma'am.
you, Dr. Mansi, for this, and also all the participants who have been there and attended the session. Also, anyone whose queries are left, they can always DM me on my page, on my professional account, on Instagram, YouTube, or anything. And I'll always be there, and we will conduct many such webinars more on any more coming topics as and when needed, right, Dr. Mansi?
Thank you so much, ma'am. So, ma'am is also there, and we are also there for your doubts clearing. And this session will be also available on the YouTube of Homeopathy 360 very soon. In the comment section, you can comment down your reviews, your suggestions, and your experience of PCOS healing or PCOS journey. Thank you so much, ma'am. Now it's time to wrap up. Good night, everyone.
Thank you. Thank you.